Hello, everyone. Welcome to our Amplifying Voices seminar. It's our webinar, which I think is the fourth. Is that right, Sati, in our series of housing and health and care programme?
That is right, yes.
Yeah. So my name's Kerry Topping. I'm a Policy and Projects Manager for North East ADA. So my role is to support the 13 directors of adult social care across the North East and North Cumbria region. And I was hoping that you could all just introduce yourselves in the chat, if that's all right. Just if you say what your name is and your organisation, and then if you're comfortable, how many addresses have you had in your lifetime, and how many of those felt like home? Because we're going to start thinking about people within the programme and sharing people's stories and people's voices, and we want to really think about what home feels like. So I wanted you to start thinking about that. So I've lived in 8 different addresses, 8 different properties, some of them private rented, most of them I've owned, one of them my parents, and I would say that 4 of them really felt like home for various different reasons. So if you're comfortable, you don't have to, but if you felt like you could say where you've lived and how many felt like home. The session is being recorded and it will be hosted on the Boost platform, so you will have access to all information afterwards, and I believe that you will get a copy of the slides after the event as well, and they'll be emailed out to you. And the link to this session will be uploaded next week if you wanted to come back and have a re-listen of any of the presenters that we're sharing with you today. Also, towards the end of the session, we will put a link in the chat to a feedback form. We'd really like these sessions to remain relevant and valuable, and your feedback is really vital in ensuring that we do that. So we'd really appreciate it if you could take a few minutes just to fill that in at the end. So the absolute foundation of the Housing, Health and Care programme was the vision that was agreed upon, I think, May 2023, where we want our citizens to be able to say that I'm healthy, I can live the life I want to live and do the things that are important to me as independently as possible. So those people, their lives, the communities, the very foundation of this programme. I think most of us on this call will probably live in the North East and North Cumbria. We are also the citizens in this statement. Many of our family members will live here. Some of our friends will be included in this. And even if we don't draw on care and support ourselves right now, or we don't face some of the challenges that some of the people in the programme, the challenges we're trying to address, we're all impacted by where we live, the homes we live in. And we're hoping that this session will share some examples of how we can amplify everyone's voices in this space and highlight why it's really vital that we all work together to achieve this vision for our region. So the speakers that we have on the call, hopefully, I know Lisa's here, that's a relief. So I'll just be doing a few more slides of introduction. Lisa, who works for Media Savvy CIC, has shared her amazing talent with us, developing the avatars, bringing people's stories to life within our programme, and she will be talking about that bit of work as well as the wider work of Media Savvy does to engage with their local community. Nick Chu, who is our regional representative for Mobilise, she'll be talking about how we use digital and technologies to think differently about how we provide information, advice, support to unpaid carers. We've got Hazel Cuthbertson from South Tyneside Council joining the call, and she's involved in local area coordination, and she has some great examples of how powerful it can be to do with people rather than for them. And then towards the end of the session, we have a chunk of our session is going to be led by Kat Duncan-Rees and Jack Savage, MBE, who are both involved with Curators of Change, and they run our Over a Brew sessions. And they wouldn't want me to describe them as experts in co-production, but that's pretty much what they are. And they will be talking about why integrated lived experience is essential for designing and delivering support services. And they've got some stories and people's lives to share with us as well. I also wanted to take a moment just to introduce this person, Kwejo Twenaboa, and he was hopefully going to join this call and talk to us about the work that he does nationally as a housing influencer. So he's an award-winning social housing campaigners and activists from South London. Unfortunately, we weren't able to make it work on this occasion, but I did want to highlight the work and the book that Quasio has written. He uses social media to give a voice to housing tenants and expose derelict living conditions, and has some really powerful videos on his TikTok. So you can find his book on most good book suppliers, and TikTok, it's at Quasio Housing. If you wanted to have a little look at some of his work. He got involved in this activism after publicly shaming his housing association and carrying out repairs at his family's flat after a year of inaction. And he now travels the country and puts pressure on politicians and social housing providers to improve those living standards. And I feel like he is really an excellent example of amplifying voices, and it is worth checking him out. And he's got some really powerful messages to share with people that you might be interested in looking at. So, as I'm sure many of you will be aware, there are many ways we can support engagement in communities, and we recognise that the very best participation happens at place. So Durham County Council and the Durham County Durham's Together partnership uses the spectrum of involvement. You may have also seen the T ladder. And what we're aiming to do in this session is move us kind of more away from the red end of the spectrum and into more the blue purple end of doing with people, and the power of doing with rather than doing to. Northeast ADAS has written some guidance and best practice examples. We've included links to toolkits and resources within that guidance, and if anyone would like a copy of that, then please feel free to email me. My email address is on the screen, and I'll be more than happy to send a digital version of that across to you if you would like some good practice guidance from Northeast ADAS. So just to highlight, obviously, co-production, co-design, listening to people's voices is absolutely vital. Valuing people's lived experience, recognizing that they're the experts in their own lives and providing that space to voice their needs, increases a sense of control and dignity, being responsive to actual need rather than what we think people might need, ensures that services are relevant and effective and person-centered. People are more likely to engage, leading to improved wellbeing markers. It promotes independence and reduces dependency. It's cost effective and sustainable when we target services, and we avoid unnecessary interventions. We build stronger communities. You know, when I opened the session, I was like, how many addresses have you had, but how many homes have you had? It's not just the house, it's not just the place we live, it's not just where we get our mail delivered. It's where we live, it's our stronger communities, it's our shared responsibility, it's our networks and how we feel about the places that we live in. And then the legal and ethical considerations about why it's so important to ensure that we listen to people's stories. It upholds the principles of fairness, equity, and non-discrimination. And I think overall, co-production leads to a more democratic and personalised and effective systems which benefit not just the individuals, but organisations and society as a whole. This was echoed in our findings from our interactive strategic event, so our serious game, as we shorthand it to, where we identified a regional priority as being co-production with joint planning and housing and social care, and that to work alongside and listen to service users is better to understand housing, health and social care needs. And we found in that session where we established that strategic space to look at innovative processes through co-production in the community, just how powerful it was to listen to individuals and communities, and how it was absolutely essential to ensure the better outcomes for everyone involved. And that included policymakers, developers, individuals within the community. When we listened to people's stories, when we listened to their voices, that was when we got the best outcomes. So there are many ways you can get involved in the programme if you're not aware of them already. If this is your first webinar and these haven't been highlighted to you in the past, you can join our community practice by emailing Sean, who I believe is on the call. May give us a little wave, Sean. We have other webinars you can book on via the Boost platform. You can find out information about our programme, and we have a virtual home learning and assessment tool that's available to you as well. And I've mentioned our Overbrew sessions. They're a safe, collaborative, co-produced space that we host at the end of every month. We do have one in April, but the June event is going to be focused on housing. And there's a link there, which we'll send out to you, and I'll pop in the chat as well, of how you can book onto that session. And we're going to consider general housing issues, but we're going to be asking questions such as, how does your home affect your physical and mental health, for better or worse? Any struggles with housing in the past year? If people live with a health condition, how do the home help manage that health condition, or does it make it harder for them? How they feel about their connection between housing and health, and that sort of thing. And it's very much an open space where people who are lived experience, experts by experience join the call, professionals join the call, and it's a safe and collaborative space to have those conversations. So just wanted to sum up before I hand over, just that the National Co-Production Advisory Group, the people who use services, are the real experts in what works. If we want better outcomes, we need to listen and learn and act together. And I think that's absolutely the kind of underpinning message that we want people to take away from the session. We want people to feel empowered to go and build your co-production or strengthen your co-production and engagement at place and the areas that you work in. So I'm going to stop sharing my screen, and I'm going to hand over to Lisa Miller. And as I said at the start, she's helping bring people's voices into our programme, and she's going to be sharing the work of our organisation as well as some of the examples of her great talent. So I'll stop sharing my screen now and hand over to Lisa. I'm happy to take any questions while Lisa is pulling up her presentation.
Hello.
Hang on a second.
Right, am I sharing? Do you have this?
Yes, we do.
Yes, we've got it. Okay, lovely. Hello, everyone. I'm Lisa from Media Savvy, and we have been an organisation since 2010. We were established in 2010, and we've always been very passionate about employability, about education and creativity. Within the team, most of us have a creative a creative background, you know, sort of before we even sort of joined Media Savvy. And we're all quite passionate about our ethos, our core sort of delivery, whether it be sort of as a commercial project or as a community-based sort of teaching project, be digital arts and media, arts and wellbeing, and digital upskilling, sort of trying to bridge that divide between, especially it became, you know, more apparent during COVID 5 years ago. Can you believe that there was a massive digital divide for everyone, and in that the communication was really, really important to stay kind of for people to stay connected. We do work a lot with hard to reach individuals from multiple backgrounds facing various complex barriers. And we sort of try to use a learning by self approach. Sort of, if you make it fun, people don't just realise that actually learning, it's like not the boring thing, it's the exciting thing. So that's kind of like our methods of approach. And we have had several awards in the past for this. So as I said before, we are passionate about our ethos, and we have a really strong, and we all pulled together. It was a democratic approach, like obviously Kerry had mentioned how important that is. The whole organisation came together to pull together our vision and our mission. So we want a society where each individual feels valued, have access to suitable education, and the possibility and the opportunity to realise their potential, whatever that may be. And obviously our mission, we want to unite and empower our community through creativity, innovation and education. So that really, whenever we sort of, you know, whenever we sort of think, oh, well, what are we about here? What do we want? We always revert back to the vision and mission. So then that sort of like pulls us back into line. So we have a positive learning experience because of this learning by stealth and making it fun. So this empowers individuals to sort of progress further and, you know, enjoy themselves, and they have constructive activities with ourselves and or other providers, because even within a teaching environment, what we teach might not be what everybody wants, but it could be the stepping stone to have a positive by having a positive learning experience, they'll go on to, learning something that's more relevant to them. Okay, so then that sort of comes back to sort of lifestyle choices, and then that because they've had a positive impact, they're empowered to move forward with their lives. Okay. So we've had relationships throughout our existence with the NHS, secondary and primary care. The Sunderland CCG, I know that's sort of that the CCG's gone now and it's something else. We work quite closely with Changing Lives, and we're about to embark on another project with those, and Northumbria CIC and Inclusion North, and another organisation, Sunderland People First, that I should have had on that list, and I'm sorry I haven't worked with for a very long time. So we've worked and created collaborative projects in a number of instances, and this is one of them. With Changing Lives, I think this is back in 2018. We did some legacy cards, so they were like just like a credit card, but it was about getting the message out about being safe online, and being safe. If you're dating online and things like that, it was trying to sort of get the women to work on a project together, pay forward their advice that from what they've learned from their experiences, their peers' experience. So each group, I think there was 9 in total that we worked with. They created and designed their own legacy card, as it was called. And there was an overall winner. I think it was the middle top one. About what they thought were the most important messages about staying safe were. So that was a really interesting and positive and engaging approach, because we delivered a sort of a workshop about being safe in one session, and then they just got together and got the key points and created these statements to help any future people that come into contact with Changing Lives. Another collaborative project. Sorry, I've left it on as the end of the academic year. I think this was 2018 as well. We worked in collaboration with Northumbria CIC and Veterans in Crisis, and it also happened to be the centenary of the end of the First World War, and there'd been a Sunderland soldier that had been missing in action for the 100 years, and just I think it was within the year they'd found his remains in Belgium. So that was kind of coming full circle, as it were. So they wanted to create a design for a stained glass window. And so we worked week on week with the Hancock Museum. We would meet there and develop this stained glass window with different messages from each decade, things that had happened in each decade since. So they're the different panels, and the middle one is the lost soldier, and we sort of paid tribute to this Private Thomas Edmondson as part of this project. So that was quite emotive as well for the veterans. Moving on to more recently, we've been working with Inclusion North, who have given us permission to share these avatars. Now, the initial avatars had to be anonymised. They were quite innocent looking. You can see, obviously, they've got big heads, big eyes and things like that. But each person who had the avatar were allowed, well, they weren't allowed, they were asked to describe how they wanted their avatar to look. Now, initially they had to be anonymised, so they were coming out with sort of like really interesting and wacky sort of, hair colours and things like that in outfits. And then they've later sort of, that there was no need for that anonymisation, so they've been able to make them a bit more like themselves. So here's just a few of those early kind of concepts. And obviously the guy on the right, he's quite into Doctor Who, so he wanted to be in the whole kind of Doctor Who get up. So he got that. That was a nice one to sort of pull together. And this is the purpose of these avatars was to create a video to have a voice. So each individual, and there could be about 18 individuals that have avatars. Each one of them we recorded a little voice message. So this is one of the part of the animation. And again, we've had permission to show this to the group, and it's about getting their voices across. So it's literally is there.
See the clouds from the wood. Don't think you know better than us. We are your best teachers. When was the last time you spent time with the people you make decisions about?
Just need to try and get out of here. Right, okay, sorry about that. So this work was pulled together by Sandy Marshall from Inclusion North, and you can see she gave us this testimonial about the work that we've done. Just they were really quite proud about how they were able to co-produce it, the individuals. You know, there was individuals with learning disabilities, there were family members, and there was some healthcare professionals as well involved in creating their own avatars. So we've obviously focused at the moment on the ones of those who the direct beneficiaries of Inclusion North, which were the self advocates. And that, you know, we did support them through the process. And initially we gave them little outlines of the characters that they filled in, or wrote things next to them and what they wanted involved with the characters. They were delighted when they were finished, and felt quite proud every time that it's shown, because it's shown at every conference that they have, at the beginning of every webinar and every conference that they have. And the audience as well have loved it as too. So moving on to the ones that we've worked with Kerry and the team. Initially, I created a few sketches of a character, so I'm just focusing on Agnes at the moment. And then once we got a style that we were happy with, we then moved her forward into being a digital rendition of her. Again, you can see we've got the descriptions always. And one of the things I thought might have been quite powerful would be to desaturate the colour out of Agnes and out of every character, so that when it was to try and tell the story of when the character was in like a really despondent sort of place for whatever reason, it's desaturated. Once things were fixed, we get a full saturation. So we're having colour here play a little bit of a role with telling the story. So we have Agnes. We've done quite a few, but we have Biraj on the left and Hitesh on the right, and we can see, you know, that the people, they are actually people here. And then we have built a little bit of an environment as well for Agnes, and she needed a tipping kettle to be able to pour a cup of tea, because she likes having a chat with her neighbours. And so she's making a few brews there and having a chat with that easy kettle, so that she doesn't burn herself. Okay, and I think that may be it. Oh no, we've got also further development. We have a bit of a brief to push Gary forward a little bit. So we need to build a bit of an environment around him, and pass them on. And then I'll be passing them on to my colleague Hatham, who will start looking at animating them. Are there any questions? Oops, yeah. Are there any questions? I'll just take you back to. I'll leave you on that one, because that's quite a nice slide, that one, the feedback.
Thank you, Lisa. While we wait and see if anyone's got any questions, I just wanted to say thank you. I think it's really interesting to hear about the value that you add into your local community through the range of work that you do and the creative ways that you engage with people. And obviously, we're very grateful that you're bringing people's voices into our program in a way. And I'm really looking forward to kind of bringing those more to life. And just for the benefit of the people on the call, the kind of next phase of the work that we'll be doing with Lisa and her team is that, you know, firstly, we'll start with Gary and just trying to create little stories and examples of how we can share people's stories and get them onto the platforms, and there'll be a resource hopefully where you can show that, you know, the benefit of early intervention, preventative work, how the things we can do in practice that make a difference to people's lives and improve outcomes, some of the challenges that people can face if we don't address some of those issues. So we're hoping to build a little repository over time where there's a little bank of resources there to either put in your own webinars or use as resources or get that message out there. And I think it's really interesting to see that range of work you get across. And I know that you do a huge amount of work with local people, and that's the power of co-producing at a local level as well. We've got a couple of questions. I don't have anyone's hand up, but I have got someone asking if they could have a copy of those safety cards for a session. So Tracy Bell's asking.
I can send a digital copy.
Yeah.
I'll be able to send, but I don't have any physical copies. We did have some made, and we only got one set each. We only got one set, so I could just send digital. If we could send me an email, or shall I send them via you, Kerry?
I'll pop your email in the chat, Lisa, in a second, and then if anyone does want a copy of that, they can get in touch directly. And yes. Barbara Douglas has kindly shared a couple of links there to some of the work that has been done on the Elders Council as well, and the Digital Me managing the Home Care Circus program. So I think there's a couple of links there that people might be interested in as well. Has anyone got any questions before we move on to our next speaker? I don't think so. Thank you, Lisa. That's really good.
You're very welcome, and thank you again, Kerry. We really find it such an interesting and emotive and powerful project to work on as well. You know, I think it's been a great relationship so far. So yeah, it's one that we want to keep flourishing.
Brilliant. That's brilliant. Okay, so we're gonna move on to Nick, who is on the call. Oh, thanks, Lisa. Lisa's put an email in the chat. I did see Nick join the call.
Hello. Have I popped up? Hiya.
No, yeah. Oh, there you are. Yeah, brilliant. Okay, I'm going to hand over to Nick, who's going to talk about a bit of work that they've been doing. I don't want to steal your thunder, Nick. I'm just going to let you do the
no
speaking.
Worries. I'll share my screen, but just to start off, I'm Nick. I am the account manager for Mobilise. Mobilise is a digital support tool for carers, and I'm kind of tasked with looking after the Northeast and the Northwest as well. So what I've been kind of asked to come here today to talk about is how the region is kind of innovating to kind of just to support carers, to find carers, and how that's kind of relevant to you guys on the call. Can everyone see my screen yet? Might take a minute.
Yeah, it's there, Nick.
Brilliant. So, who are we? We've worked with 40 local authorities, NHS bodies, carer support organisations, and ADES groups across the country. There's a few little logos there. Some of you might see ones that you work within. But really, for every 1,000 unpaid carer reach and breakdown, there's an estimated £14.7 million cost to the system. So why do we kind of exist? What are we doing here? Why am I on the call more than anything? So Mobilise is a digital service to identify and support carers, and it provides support that we're trying to prevent and reduce and delay the reliance on more costly local authority support, health support, NHS support, whatever support that's being kind of funded, we're trying to kind of reduce that. So North East ADAS and Mobilise are using the ARF funding, which is accelerated reform funding, which some of you might have heard of, to fund the project across 13 local authorities in the North East. And we're trying to reach over 150,000 carers in the region. We're providing scalable, cost-effective support for them and reducing the demand for crisis intervention services. So a little bit more on the work that we've been doing so far with ADAS and with the 13 local authorities. So these little dots here, this is every carer that we've mapped so far, and this is a carer who's given us a little bit more information about themselves, but that kind of shows the spread of carers that we're currently working with Mobilise. And there's around 15,000 so far that we've mapped. In terms of the numbers, we have reached over 93,200, so that's about a year in, and we're supposed to be 150k, so we're doing all right there. We've engaged 4,258 times, supported 11,479 times. So I'm going to delve into a little bit more about what those engage and support actions mean a bit further on, but it kind of shows around 15,000 deeper engagement and support actions for carers digitally. And I guess something that's quite interesting to the people on this call is the demographics of what a mobiliser, someone who's using this digital service, looks like in the Northeast. So 63% of people in the Northeast using Mobilise are using it outside of working hours, and 67% of them are of working age. So you're kind of seeing that cohort there of people who aren't maybe your usual suspects in a carers centre, who aren't going to more traditional services, but are using the service outside of hours when they need it. 79% have been caring a while, so these are people who they're not just new to caring, they've had caring needs, but 81% of them haven't accessed support before as well. So it really is that kind of untapped cohort of carers. So you might be coming in contact with them, you might see them coming through your doors, and you might not even know the carers. That's kind of what we're aiming and hoping to support with this kind of project. So what does that look like? So there's changing, why do we exist? Changing user behaviours. 97.8% of the UK population is online, which I think is quite a crazy statistic to think about. And obviously there's varying levels of online, but most people within the country have connections to internet. And there is now an expectation of accessibility and convenience. So we're looking at like the fast-paced nature of the world now. I know myself, I want to book me appointments online. I want to do everything online and only have to see people when I absolutely need to. But moving away from services and towards community. And we've seen this even in within the year that we've worked within the Northeast. We've seen a lot more services go into that community-based that health model. So it's been really good to see that we're able to kind of integrate with that as well to support in an online community. And seeing that housing, health and care are all working together to support carers has been a nice feeling within the Northeast. So system capacity, I think everyone will know that everyone is stretched. There's not enough funding, there's more demand, people are needing more things. So we're all trying to support it, and what we've created is a digital solution to try and support that. Create solutions reaching 11 to 26% of carers. Current solutions are only reaching that. So as we were saying there earlier about that demographic in the Northeast from carers that we're working with, we are kind of tapping into maybe that. I'm not going to go and say the whole hog of 76%, 74%, but hopefully a little bit more of that reach for carers. And wider community services, often now the front door to wider support. So there's so many different avenues now that people are able to access support or even ask for help. And we just wanted to try and hope that as a digital service like that works across all 13 local authorities, that we're able to kind of break down that postcode lottery of support and be able to help support the system any way we can. And again, I think it's not a kind of hidden fact that with those kind of restrictions on funding and the service demands, there's more reliance on unpaid carers within our communities to provide that support. So the likes of virtual wards have been increasing across the country, and that often relies on an unpaid carer to help support a health professional in keeping that person in a virtual ward at home. Complexities of conditions, so we've seen a lot more carers now with multi-needs and multi-condition support, so that's had a bit of a demand, increased demands on the system. Hospital discharge, so we've done little bits of work within the Northeast on that. There's definitely more that can be done across the region, but there's we've been hoping to support that in a sort of digital way, that we're able to say that not just for the cared for, but the person caring, that we have some support there for you. Cuts with local authorities and health, seeing some services disappear from the local landscapes. So I guess everyone will think about maybe 15 years ago when there was a service that they maybe relied on, or someone they knew relied on, and they may not be no longer in service or commissioned, or may just no longer fit the community needs. So we're hoping that with a digital offer, we're able to kind of wrap around the existing services and really support it. Who we are, so prevention, we focus on upstream prevention. I think that's a word that everyone is using at the moment, but what we're really trying to aim for is making sure people aren't reaching that crisis point, that we're able to do that light touch bit of support and really give them support before they reach crisis point and make sure that we're not going further into the system. However, there is also the pathways. We've got the pathways there if they do need that support. So we are working with carer centres at the moment and starting to filter some carers through there as well who might need a bit more. Technology to bring people together. I think the community, I've mentioned it a few times, but is one of the best things about Mobilise. We've got an online community of just carers from across the country. There's specific spaces for the Northeast as well, but there's carers from all different walks of life, with all different varying lifestyles, varying levels of care, and it's really great to see them come together and support each other. And I think that links quite nicely to the mobilise the wisdom, knowledge, expertise of carers. So one of the main things that we do as well is provide information as well. We've got a multitude of guides, tools available to carers to rely upon when they need it. We've got ways in which we drip feed certain bits of information to carers as well, through newsletters, through spotlights information, to make sure that carers are equipped with the right information at the right time. And as well, the expertise of carers. Most of the people who work in Mobilise have got a caring background, so it came from carers for carers. But also, when we're talking about that community, the peer support is amazing. We see at any time of the day, it could be 11 a.m, 1 a.m, we're seeing people drop a message to be like, I've been through that situation, this is how I've dealt with it. And it really is empowering carers to, one, support themselves and also support each other, because at the end of the day, carers know best about a lot of these situations, and also it really creates a nice community. I'll touch on a little bit in a minute, but there's a really lovely story about an air fryer in which someone needed an air fryer in Blackpool and they were like, I can't afford it. Oh no, someone needed one in Cornwall and they couldn't afford it. So someone in Blackpool was able to get that physical air fryer down the country through the community, and make sure that that person in Cornwall was able to get it. And they all had tea and everything. It was lush. There's pictures. I wish I'd put one on here because you can just see how that community translates to real life as well. So the identification, so we do things a little bit differently here. We are using social media, but we're not doing the usual organic social media. We're using paid advertising and paid advertising channels through Facebook, through Instagram, through Google, to really try and tap into carers that might not see themselves as carers. I think you can kind of see here, looking after someone with a disability. So we're using the terminology of looking after, so we know how important it is to kind of switch that narrative that they're not carers with that carer terminology, to try and get them on that step towards acknowledging the carers. We use search adverts and display adverts, so some of them can be, say if someone's looking for incontinency pants, we can be able to pop a little advert in Google that's saying, are you looking after someone? And it'll guide them through to that localized support, and that digital support. We're also geo-targeted as well, so it's aiming for the Northeast, it's aiming for those certain areas that we are working within. So there's loads of different tools. One of the examples is the personalised guide to caring, which is one of the easiest ways into Mobilise, I would say. It's a really light touch service where it's an email course, but it tells us a lot as well about the carer. In that little short form that they fill out, they tell us their caring situation, how many people, like how many hours they're caring for, how they're feeling as well. So we're able to kind of craft a little support plan around them, but through digital tools. So this is a really good one. I would say there's going to be a slide later that's a link to it. If you want to share that around, that would be great as well. And the community, so yeah, we've got the Mobilise Hub. So when we're talking about community, the community is not just an abstract thing in the internet floating around. It can be, it's on your phone, it's an app, and it's also on like your desktop as well. And there's loads of different sections there. There's condition-specific ones for things like dementia. These, like I was saying, the local spaces, which is an area where people say from Gateshead can talk to people from Gateshead, and then also can see the local information that's been put on there. So we're working with voluntary groups and carers organisations to populate that page as well, and make sure that all those pictures, all those events are relevant to the person that's seeing it. So they're only seeing the things they need to. There's also live events, and there's also virtual cuppas as well. So similar to like what you think of a coffee morning, we're doing them online as well. So I thought I'd put a few little words of what people in the North East are saying. I'll not go through all of them, but I'll maybe pull out a few little things. So in South Tyneside, I wish I had the words of wisdom to pass on to you. Try and take strength from the fact that there are many, many, many of us in the same boat with you all ready to listen. So I think that's really expressing how that community is really, really strong. Thanks for that. We from Cumberland, we all need encouragement from time to time. I think, yeah, sometimes we don't need to be bombarded with information. We just need a little bit of support. In Middlesbrough, it's great knowing you're an email away. I think that's sometimes the case. We have these email subscriptions. People sign up to them, and we'll track when they're reopening the emails, and we'll be like, oh, we've not heard from that person in a while. Should we reach out to them again and see if they want to be taken off our mailing lists? And a lot of the time it's like, absolutely not. I'm enjoying the content. I just like knowing that you're there, and that if I need you, you can support us. And so coming back to that community aspect, what does that mean to people that you're coming in contact with? We can be a digital social prescribing resource for carers experiencing isolation. We are helping that mental health support, some things that are kind of maybe not needing intense or massive support, but we can be there, and that online community can really wrap around them. Informed, we enable local and regional messaging throughout the ICS, and we can also do housing consortiums. So using that spotlight system, we worked with the North East and North Cumbria ICB to get our message to loads of carers, and we did it through a few different channels. We did it through the direct messaging, we did it through emails, and we just got that message out there. For Newcastle, we did some stuff for the CQC and got that out there, and they actually got physical people ringing them up to give them support. So there is still people behind those messages. And Empowered, there's so many tools that can be used not just by carers but also professionals. So we've got things like the Mobilise Assistant tool, which you can just pop in a question and it'll kind of not regurgitate, but it'll tell you an answer that is related to carers. And if it's a specialised area of caring that you're not too sure on, or if you need to even know your local information, type it in and put the postcode in, and it'll tell you what the carer centre is in that area if you need that, or how a carer's assessment works if you're with a patient, or if you're with someone who you're coming in contact with who might be needing a carer's assessment. You can start to break down that barrier alongside them if that's if you've got the time. If not, you can also give them the tools to empower themselves. So these are just 2 QR codes. I'm going to send this presentation afterwards, so you can have these in your bank, you can pass them on. The one on the right is the Personalised Guide to Caring, which is like the easiest entry point to support for a carer. And the one on the left is a North East landing page. So that's going to have all the areas in the North East that we're working on. It'll have links to their individual landing page. So it's a really nice little base there for the North East. So yeah, feel like that's me. Have we got any questions or anything like that?
A lot of reactions and a couple of comments in the group, Nick. I just wanted to say a couple of things, like thank you for all the work you do across the Northeast. It's been a really good programme. We funded Mobilise through the Accelerated Reform Fund money that came from the DHSC, and it is a free access for anyone who lives in the Northeast and North Cumbria and who's offering unpaid care and support to people. I always really appreciate how person-centered you all are, and I really like on social media that I think is it Linda who responds to every single comment, whether it's to do with caring or not, with like patience and empathy. And we aimed for the project to provide people with choice, to identify people who might not see themselves as carers, who didn't necessarily want to access some of those existing models of care support. And I think it really ties in with the programme for health, housing and care, because particularly around complex needs and older people, there's clear care and links with those work streams, as well as when you're thinking about people who are living in conditions where they might be living with damp and mold, they'll have care and responsibilities and some of the additional challenges that can face. And we really wanted to highlight that, there is support out there for people who may be busy with work, may do shift work, and just so that we can get that out there and say, share it with your networks, let people know it's available to them if people are facing challenges, or even if they just want a little bit more support in a conversation. It doesn't have to be that in depth, does it, Nick?
No, it really doesn't. It can be really light touch, but then we can also provide a little bit more support. We really do a breadth of support and information, and I think one of the main goals is, like, I was thinking about this, we had a meeting on Monday. As you can tell, I'm quite a rambler. But we had a meeting on Monday, and it was about the mission of what Mobilise is, and it was to ensure that carers can thrive independently. And I think that aligns with so many other organisations. We want to make sure that every carer is getting the best out of their lives, and if that's through just a little bit of information here and a little bit of information there, that's the best we can do.
Yeah. So there is a couple of questions in the chat, and I think you probably be best off answering them, Nick, if that's all right. So one from Sarah saying, you mentioned technology. Does Mobilise provide this for carers who support them when they can't be there to remotely monitor if required? So I think, is that a question of I'm not sure, Sarah, do you mean the physical technology? So you don't provide
No, we don't. But we have been So we don't provide physical tech. But we have been doing some sessions across the Northeast and upskilling people. So going into areas where there's yourselves, where there's training courses on how to use emails and how to do that, but talking about Mobilise as well, because it can be a barrier that it's an app and people are like, I can't download an app. So really just talking about the benefits of it. So there's ways in which we're trying to break down those kind of digitally excluded barriers, but we're not providing tech at this point, no.
We've got a couple of requests for you to get in touch with people. I'll let you reach out to them as well. Some compliments on the programme, and then how we've shared it across wider networks and housing associations. I know that when we first commissioned you guys, we did a lot of comms from a Northeast ADAS point of view, and I'm not always completely sure how far that goes. I just kind of send it out there and then say share with your networks, and it's difficult to test it. But you've been doing you've done radio adverts and all over Facebook and
absolutely. So we do the paid advertising, which is going direct into carers' houses, into their phones, trying to get to them there. We've worked with different comms teams across the region, so the local council comms teams, to get different bits of information out there, especially at Christmas time. We had a Christmas cuppa, so we did a bit of a campaign there where we provided like a little comic strip and everything that was trying to help people come to the Christmas cuppas and show that there is support outside of working hours during the Christmas time, which can be quite high demand. And we've done the advertisement as well, so we've done paid radio advertisement. We've also been doing some local radio stuff as well. So James, who is our CEO, you'll probably see or hear of soon, because you will do. And he did a lovely interview with Radio Tyneside, and I think that's going to become a little bit more of a reoccurring thing, and doing a little bit of segments on that. So that was really positive. We've had TikTok campaigns to try and get that even younger demographic of people, so that's worked really well. In Middlesbrough was one of the best places that happened in. The TikTok campaigns really took off there. So what we're doing now is we're going to be looking at that in this next phase of the contracts and this next year, putting a bit more funding behind that. We've had James was also on Look North, so there's been loads of different things going off and trying to get it out there, but I guess there is always more that can be done. I think that's you can never underestimate the power of word and spreading things, and even just like having this conversation here and speaking to all of you, I think that's really helpful in getting a bit more of awareness of it being in the Northeast across boundaries. You're not going to have like a postcode issue of where the cared for lives or where the carer lives, and it is free. Yeah. There's no payment. I know that some of these kind of apps do have subscription services and things like that for carers. Oh, well, people using it. I know that I think there's a mental health app that you've got to pay for it. But this one's completely free. So we're not adding another barrier, especially during these times where there's financial constraints on carers' allowance and different kind of funding streams going off in personal lives as well.
That's brilliant. Diane's asking if we've got paper collateral to spread like the message, like flyers. I know we've got things like QR codes and things like that. Can I leave it up to you? I mean, we can put some QR codes in the information that goes around so people can access it that way, but maybe if there's, I don't know if Diane's thinking maybe just leave old school, leave it on a desk in a reception area somewhere.
We do have some flyers as well and stuff that we can send out as well. It really depends on what kind of saying, is it paper flyers? We can work on that as well. And depending, we can do a bit of co-branding on it as well. So there's ways in which we can do it and produce that if that would be helpful. Yeah, and I know you've got things you can print out, haven't you? Sorry,
it was just obviously from experience, we know that obviously whether it's trades or it's community connectors with our development teams, because we're I don't know if you know, but we're across all the region of the Northeast, so it sometimes helps just to have a physical thing to give somebody. And I think because obviously we've got a lot of our customers, and like you say, there'll be a lot of people that are using social media and trust Instagram and, you know, really good source of information, but other people that might be a little bit wary. So it's just that endorsement really that this is, and that it's free as well, because I think that's really important as well. They don't think they're signing up to anything. So yeah, I can ask our teams internally, and if they think that's a benefit, I'll let you know if that's okay.
That would be brilliant. Let me know.
Thank you. Thanks.
I really like the idea of having that free element really in bold. And there is that kind of distrust in some ways, I think, especially when it comes to these like Facebook ads. We've had people say before, "Oh, thought that was a scam." So anything that can be kind of work together to kind of co-branded or legitimized really helps that barrier as well, to be like, actually we are commissioned by like the region, we do have official backing, it's a real thing. So that does help as well. Thanks, Diane.
Thank you.
Great, thank you. Right, we've got a couple of minutes, and I know that Hazel is typically tied up with on-site CQC assurance inspection and is joining the call at 11. I don't know if she's managed to get onto the call yet. I haven't seen her join. And I'm wondering whether or not, do we have a quick vote in the chat as to whether or not you want to watch a very short video of one of the Quasio Tweneboa videos that I was talking about, or whether you would like to go and grab a cup of tea and come back at 11 o'clock. I'm thinking the latter. While we wait for Hazel to extradite herself from inspection interviews. Tea, yeah. Cuppa, right. So everybody, you've all got your cameras off anyway. If we all just, she's here. We'll go and grab a cuppa anyway, and then come back at 11 o'clock and we'll get going. And I'll let Hazel in. I've got biggies, but I don't know how I'm going to get them to you, Christina. Okay. Right. We'll take a short break. Hazel, you've just joined the call. We're just having a quick cuppa for everyone's comfort. How's it going at your end? Bearing in mind we're being recorded.
It's all good. Thank you.
Good. Right. Brilliant. Right, excellent. That's good to hear. So we're just all having a 5-minute break. Is that all right with you? And we'll be ready to go at 11. Yeah, I feel like I committed it, and then you joined the call. And now I'm back in. Yeah,
no, quite all right. Everybody's expecting a break. That's fine by me. I thought at least I'd join a few minutes early. Then you weren't panicking in case I didn't turn up.
Yeah, thank you very much for that. You joined just when I committed to letting people go and get a cup of tea. So we'll take those 5 minutes. I'm going to do that myself if that's all right. Welcome to Hazel from South Tyneside Council. Thank you for joining us. I know you're very busy this week, so we really appreciate you making the time.
That's quite all right. It's always a great opportunity to talk about local area coordination. So thanks for the invitation. Thanks for the welcome, Kerry. So I work for South Tyneside Council. I have a wonderful job, and that I manage a very small but perfectly formed team called a team of local area coordinators who are delivering the local area coordination approach. What I intend talking for about the next 15 minutes about is primarily what LAC is, to give you that understanding, and I'll pepper it with examples about some of the impact we've already been finding in South Tyneside. As I said, there's a slide at the end, a couple of slides at the end with lots of opportunities to follow through some links onto the local area coordination, the national website, to be able to look at some videos about people's stories, about the impact LEC's had in their lives, contacting us myself for the network program director, and also a link to a book that was published 2 years ago called Power and Connection, which is the description about how local area coordination has evolved and developed over the last 30 years. So that's what I'm planning on taking you through this morning. We, just by way of context, from a South Tyneside perspective, we began to work with the local area coordination network about 2 years ago, and we had our first coordinator appointed and in post in February last year, followed by a further worker in April, and then another worker starting in July. So we've got 3 local area coordinators, and we have funding this year to extend into a further 2 neighbourhoods within South Tyneside. And I'll explain a little bit more about all of that as I go through, but that's where we're at. We're not the newest local authority working to be implementing local area coordination, but we're still fairly new in our journey and seeing the difference it's making. So first of all, about just a little bit of a background. It's an international approach. Local area coordination started in Western Australia in the 1980s, and it actually became a model throughout the whole of Australia and through all its different federal states as an alternative way of supporting people with disabilities, moving away from the traditional service model and instead working with people in their local communities, recognising their strengths and assets and their rights to be equal and active and included citizens in their communities. It's been subject to 17 evaluations. It works. There's a clear approach. It's got a clear model, but its efficacy and its effectiveness has actually been confirmed. And last year, there was a research published which compared LAC in 4 different areas within England. Again, looking at what is it that makes it work, and those 4 areas were very different kind of local authority areas, and that was the subject of the research as well. But all of that information you'll be able to, and all the evaluations you'll be able to find on the Local Area Coordination Network site. So local area coordination has been in England and Wales since about 2008. If anybody on the call can remember, back in 2008, and the policy change around personalisation. You might remember the Putting People First Concordat, which had 4 cornerstones of how we achieve personalisation. One of them was about building social capital, and local area coordination was being promoted then as one of the ways how you could work differently with communities to help people have that social and emotional connectedness and relationships with other people in their communities. And initially it was the local area coordination network was an entity in its own right. But then probably about 6 or 7 years ago, it came under the umbrella of Community Catalyst, which some of you might be familiar with for some of their other work, for example, around marketplace development for SMEs, people with direct payments, personal budgets. So Community Catalyst is the umbrella organisation, and the Local Area Coordination Network sits within that. And to be implementing local area coordination, we have to be a member of that network. So at the moment, there are 13 local authorities who are working in this way. There's only 12 on the map because Croydon has just signed up and just joined, and I haven't got the map showing Croydon on there as well. But you can see where those local authorities are. Some local authorities have implemented local area coordination, and then they've needed to step back, quite often because of funding issues or just general budget pressures. But at the moment, 12 active with active local area coordinators, and Croydon just about to start recruiting theirs. So there's about, as I say, about 120 local area coordinators across the country. Coordinators are based in communities of about 8,000 to 10,000 people, so reaching about 1 million population. And as a member of that network, we actually work together collaboratively to support each other's development of the approach and also its ongoing development and enhancement in terms of sharing the learning, and also having a peer support group for the coordinators. So for example, I've just had a new coordinator started a fortnight ago because we had a vacancy in one of the roles. And she's already been linked up with another coordinator in another part of the country, and they'll be both going through their induction together. So it's a great way of ensuring that practitioners across the country are connected in with each other, are absolutely connected to the approach, and maintain the fidelity of the approach, which is absolutely critical to achieving its success. Not that maintain the fidelity is hard, because it's a fairly straightforward, simple approach. So with local area coordination, we see impact at 3 levels. We see it with people and families because they're achieving better life outcomes, support them to increase their resilience and capacity and become contributing citizens rather than the label of service users. Communities become stronger and better connected and more inclusive. And system services are the system, we see impact there because services are avoided and only used when needed, and so we divert cost the system. But the other critical aspect of local area coordination is that this is about system transformation and designing our systems differently. So the knowledge that we get from our coordinators feeding back into the local authority, into the health system, into our housing system, can help us think about how are we delivering traditional services and what can we do to improve that so that people are actually benefiting from them, and that all of those potential unintended consequences when we design services that we didn't think might be disempowering or we didn't think would actually make people's lives harder, we can get that real-time feedback and then think about the change that we could make to the system. But critically, this is also falling within that prevent, reduce and delay agenda of the Care Act, because we are working with people in their communities, ideally and hopefully before crises emerge, but when crises do happen, that we work with people in a different way so that the result isn't falling into or becoming caught up in the world of adult social care or children's services, but they're able to access the local assets and resources available to them to help them live a good life. So our current traditional model of services is it's a crisis-driven system. We have people who are isolated in the community, not knowing where to turn to for support or help. They might turn to their GP, they might turn to social care, they might turn to children's services in the first instance, and they might get responses of, oh, well, actually, it's not bad enough yet. Here's some information about an organisation in the community that might help you. And so then they might not come back because their experience might have been poor, or the problems that got to such a stage where they're in crisis, and then they experience a social care and health system where the crisis is quite often compounded because there's a delay in assessment, there's a delay in determining eligibility, there's a delay in receiving funding, and ultimately they might end up receiving services, but those services are generally delivered in a congregated, segregated way, so that person still isn't connected back into their community. They're receiving services, they are labelled as a service user, and of course there's costs to the overall system. Instead, the model that LEC is working towards is citizens in the centre being able to access all the things around them. So they're drawing on the natural community support and universal services. They're in a position where they feel that they can take action and support their community, that they have a voice, that they're heard. So even when people do need services, they are able to access and those services in a way where they're hopefully more able to articulate what works well for them, as opposed to being a passive recipient of what's available to them. About support people develop their personal networks in the community where they live, easy access to information, helping people discover what their dreams are and what their strengths are, and how they themselves can be that that person that will, enabling them to reconnect with maybe past strengths or develop new ones, new skills, just to help in order to help them overcome those challenges in their lives. And basically what coordinators do is that they get to know people, and the citizens themselves get to know other members of their community and create and develop those personal networks for themselves. So there's a charter for local area coordination, and it's basically about developing partnerships with people, with place, to strengthen capacity, to welcome, include and support people as valued contributing citizens, and not as people who need services because there's something wrong in their lives. But this is about shifting the dial towards truly recognising that people are able and should be empowered, and not disempowered, to be in control of their own lives and to achieve a good life for themselves. So some of the key features about how local area coordination actually works. So a local area coordinator, I mentioned before, they're based in a population of 8 to 10,000. They are rooted in that community. They're not based in the town hall or in any office where they then go out and do a visit and then come back again. So they're completely accessible, approachable and flexible. There's no referral criteria. The only criteria to receive support from a coordinator is that they live in the area where the coordinator is based. And that's it. There's no referral forms, there's no criteria. It's just a conversation. So by being physically based in that community, that coordinator gets known to people, they're accessible. It was funny, Jackie, one of my coordinators the other day, was saying, I was rushing to get the metro to go to the next appointment that she had, and the local vicar was literally hanging out the church window shouting, "Woohoo, Jackie, I need to have a quick chat with you." And it's that kind of accessibility, and he was sharing some fantastic ideas about some resources that he'd attracted into the church and how Jackie could then, through her knowledge of the local community, promote that and bring people in to access that support as well. So introductions we talk about, we don't talk about referrals, because it's much more natural, isn't it, to introduce somebody to somebody else, to introduce Mary to Bill. People who live in the community, we don't talk about, oh, I'll refer you to Bill because he loves gardening, or he's a real expert on computers and he'll be able to help you. And what local area coordinations do is that they take time to get to know people, and they invest in trusting relationships. And that trusting relationship goes back to just being part of that community, being there for the community, but also when they receive an introduction and they're having those initial conversations with somebody who might just be looking for some information, but they might also be just figuring out and sussing out, can I trust this person? Can I trust this coordinator to help me overcome the challenges I want to overcome in my life? And will I know that they'll do it in a way that respects me, that respects my skills, and that doesn't just try to come in and fix me? You'd never hear a local area coordinator saying, oh, I know what you need. And nor would you see a local area coordinator ever going out with like a preset list of things that they're going to suggest. It's that genuine time, and they have the time and the capacity to build those long-term trusting relationships with people. Local area coordinators, as I say, they won't try and prescribe solutions or fix people. They see people as experts in their own life, and they look to support people through natural community connections. So I'll pepper this with a little. It's one of the things that's actually happened in the community. So Karen was she was diagnosed with a neurological condition, which meant she couldn't leave the house unaccompanied because of seizures that she had. And these were not like an epileptic fit. It was a seizure where she kind of like just loses. I can't quite describe it, but yeah, she couldn't leave the house unaccompanied. Her mental health was deteriorating. Chronic sense of loneliness and isolation, having no sense of what's the point in getting out of bed every day for. Her relationship with her husband was deteriorating because she was trapped in the house. And this is a woman who'd previously been really active in her community. She was the helper. She would take people from groups. She was very involved in the Carers Association, lots of things in her life. And she was on the cusp of receiving a direct payment because she'd had her Care Act assessment, she had eligible needs. The only thing the social worker could think about was her receiving a direct payment so that she could pay somebody to take her out. So that would be a paid relationship where she'd be an employer. And she might have got out of the house a couple of times a week, but then she would have been back in that house again. Instead, what the coordinator did is when she first met Karen and talked with Karen about what did she want to do? What would bring her joy in her life? And she said, I just want to get out. I want to get out and have a cuppa. I love being outside and I love talking to people. And I'm just not going to get that at all at the moment. So the coordinator went away, and at the same time, she'd been just introduced, well, she'd just met very informally a woman in a local cafe who she'd been relatively new to the area, and she was looking for friendship groups as well. She was really struggling to make any connections. And in that local area, there was a park, and it's got a Friends of the Parks group. And Marnie knew about this, so the coordinator knew about this group because part of what they do in the first couple of months of their job is that they just walk the streets to find out what's available in the community. They meet people. They literally just go up and talk to random strangers and introduce themselves, who they are, and they build those relationships and connections. So long story short, what ended up happening is that Karen was introduced to this other lady at the Parks Alliance, and they've become best mates. Karen has also met a whole load of other people in this community, and she's actually reconnected with people that she'd lost contact with over the years in the community. She now is also volunteering in that space, and those people just welcome her, and they all know what they need to do if she has a seizure. It doesn't faze them because it's just Karen. And so she now has a wonderful life where she's probably out the house 4 out of 5 days a week. She's got the confidence to be suggesting to the other women that she's met and some of the men, oh, I've seen this activity, this group being advertised. Does anybody else fancy going along? And she's got a network of people who will now come and call on her and walk with her to these different various venues. And she's got the confidence to actually ask people, would they like to go as well? Because she doesn't feel that she knows she's being helped, but she's as able to give back into those relationships as much as she gets out of them. So now we've got Karen, who's completely connected into her natural community, no adult care services, no ongoing costs. She's living a good life. It's not where she was before she had a health condition, but it's an awful lot better than where she was finding herself at this time last year. So the relationship with the local area coordinator lasts for as long as necessary, as it turned out with Karen. Because of her, her natural personality, she's very outgoing in nature. She just needed some help to get to find these connections. The coordinator only walked alongside Karen for about 3 months. But it could be much longer than that. And we've got coordinators who've been walking alongside people literally probably about 9 months now, and that might well continue on for another 6-9 months a year. Karen herself might come back in the future and say, actually, I've got a new challenge in my life, which I'd really like some support with. Can anybody help me? And the way the coordinators are able to have this capacity to have these long-term relationships is because there's very limited, in fact, we've got no paperwork. We've got some tools that they might be able to use. We've got a database where obviously they record their activity. But because they're not fixing people, because they're not walking away from a meeting with somebody with a great big long to-do list of, oh, I'll give this person a ring, I'll give that person a ring. They've got the capacity to keep meeting people. And we've also got a situation where as well as getting to know what's available in the local community, coordinators are also available to help people create new groups. So one of our coordinators has been walking alongside a number of women who have lived experience of domestic abuse. And she's met them all individually and began to realise, oh, there's some connections there and connections there. These women have now formed their own group. So again, the capacity has come that these women are now connected to each other. So there's that peer support and that community support for each other. And that then creates the capacity for the coordinator to be starting to walk alongside more people once that group becomes up and running and developed. And so it's really important for us that coordinators have one foot in the communities and one in the service system in order that we can be getting that feedback. So the coordinators are telling us about, as I said earlier on, the challenges that people are experiencing in their communities, so the system can then begin to think about it. And one of the ways that we do that is by people who are so generous and so kind to then share their stories with us. So we have a local area coordination leadership group that's made up of strategic directors from across our health and care system, and they listen to what people have experienced by having a coordinator work with them in a different way to their traditional experience of services. And that's really impactful and helps them think about taking that information back into their organisation and reflecting and thinking how might they work differently. And ultimately, coordinators have people avoid getting lost in the gaps between different services. We've all had experience of people who've had negative experience of health and social care system, who are frightened of it, negative experiences, or they just think, oh, I don't want to bother anybody. And they often fall through the cracks. But by a coordinator being available in the community members can be saying to the coordinator, I think my friend needs to speak to you. And that's how those natural connections and accessibility, the approachability and the flexibility leads us to be delivering public services in a very, very different way. Everything's underpinned by 10 core principles, and these drive everything that we do, not just in terms of our work, walking alongside people in the community, but also as a team and also as a network. And we have reflective discussions, we have reflective practice sessions where we're really focusing on actually how is our work enabling people to be active citizens? How are we support communities become further enriched by inclusion? How do we ensure that people are exercising true choice and control over the smallest and the biggest decisions in their life? And a belief in a commitment to lifelong learning. You know, every day is a school day, can't it be, if we're given that opportunity? But if we're not given those opportunities to develop and extend and explore ourselves and what we can do, then we're going to just further undermine people's abilities. So I'm not necessarily going to talk to these 2 slides because I've probably just about running out of time, but they're there really just a bit of a prompt when you do get the slide deck, as so you can see as a reminder about some of the things I've just been rattling through here. I generally could talk forever about local area coordination and go into so much detail, and we've got so many wonderful stories of impact in South Tyneside. It has really been quite phenomenal, to the point where, you know, this financial year we have 2 additional posts, which is amazing. So further information on there's links to the local area coordination network and their website, people's stories, my contact details. More than happy to have any follow-up conversations with people afterwards, if you want to find out more or find out more about how it's happening in South Tyneside. I've also put Nick's email on there. Gosh, I've spelled his name wrong. I've changed it before I send it out. Nick's a brilliant bloke. So he's the program director for local area coordination. He's actually, some of you might know him because he lives in Newcastle. He lives literally just around the corner from where I do, which is quite bizarre. But you know, he's worked in homeless charities, housing charities in the northeast before, so you might know him. One of the things I would say is that when you speak to the local area coordination network, when you speak to Nick, there's no hard sell. He's really respectful of where organisations are up to in terms of their journey and exploring public sector and service reform, and support local authorities to think about how they can work with residents and citizens differently. So he's a great guy. And then I've just put the link into that Power and Connection book, which is where 2 of those the infographics I put on at the beginning are from there. But that's an interesting read if you want to look into more about the history of local area coordination, how it evolved, how it's developed, and where we've got to where we are now. So hope that's been helpful for people.
Really interesting, Hazel. I think it's absolutely vital that, you know, you put that context of people and communities when we're talking about housing, health and care, that it all is people and communities, isn't it? That's what we're ultimately trying to get to. There is a question in the chat around who's providing the funding from Barbara.
So at the moment, South Tyneside Council is, and which is wonderful, because generally when local area coordination starts off in a local authority, it might be driven by public health, it might be driven by adult social care. In South Tyneside, adult social care have been the ones to say, we want to be looking at introducing this, but in actual fact, we put an internal bid in for some into the council a couple of years ago for funding, and it was approved. And then the second round of funding is also coming from the council, because local area coordination not only supports the adult social care strategy of, you know, along the lines of prevention, early intervention, increase people's choice and control, but it critically supports the council's strategic priorities as well, which is about people living in strong, healthy communities and our commitment as a council to prioritising prevention. Generally, though, it can be, and we would hope that in time as we evolve and develop, that there might be funding available from other sources, whether that be the ICB, whether that be other partners, but it can be a mixed economy. But at the moment, the council is fully committed to this approach. I always describe it, the adult social care was the driver, but it's a council who are, you know, implementing this and fully committed behind it. We've got sign up from all the strategic directors, all the cabinet. It's very strongly supported.
Yeah, brilliant. And we've got a great comment from Mark Humble in the chat saying that love the approach, uses the language of not service land, so not service land language, that community and family, and that, you know, those people who don't live in our kind of professional worlds don't talk about personal outcomes. They talk about dreams and ambitions and what they want to do. And I think that takes us back to that vision around, you know, what we want for our citizens as part of the housing, health and care programme. We want them to be able to live the lives they want to live in the places that they want to be in, and the local area coordination helps people do that and provides like a bit of a conduit, doesn't it? So yeah, absolutely brilliant. And thank you very much for taking the time out of a very busy week to come and share the work that you're doing with us all. We really appreciate that.
Yeah. And it is, I was going to say, it's a very genuine offer. If anybody does want to have any follow-up, then, you know, please just give me a shout.
Yeah.
Because it's interesting. There's a few of us as managers or senior managers across the 12 local authorities who have been working in this world for quite a few years. But, you know, and we all generally say it's the best thing we've ever been involved with.
Yeah.
It is truly amazing. Yeah.
Brilliant. Thank you so much.
Thanks very much, everyone. Then.
Thank you.
Bye for now.
Bye. We'll get those slides coordinated, pulled together, get them out to you. Sati and her team will help with that. And I'd like to welcome to the session Kat and Jack, who I know are on the call.
Hello.
So
Hello.
Hi, Kat.
Can you hear us?
Yeah, we can hear you. You're not front and centre just yet, but
oh no, you're
hopefully
not going to do that weird pin thing, are you?
I'm not going to pin you. No, no, no. No one needs that in their life.
And Jack, I can't see Jack on my screen either because she's
maybe when she speaks. In true Over a Brew style, we had a 5-minute break and managed to grab a cuppa, so we should all be quite content. Okay.
Sorry, I'm just trying to write in the chat as well at the same time as talk. Anyway, sorry, I'll stop doing that for a minute and I shall say hello. I'm Kat from a very small little enterprise, Curators of Change, and I've had the privilege of working alongside Jack over the last few weeks in preparing for this session, but also in bringing some of the work that we do to the northeast, which is the Over a Brew stuff. And it's a brilliant segue, actually. I love the local area coordination. It's great to follow that for many, many years, and it's great to hear the impact that that's having in the region, and hope that can be more. But I think what we do is we're taking it a step backwards just to really create that space for people to have conversations, to explore some of this stuff from the perspective of lived experience, and how it can be, how we can make the changes that we need to make, but in a much more relaxed sense, over a brew, as the title says. So yeah, we work in lots of different local authorities up and down the country, and we're working regionally with the East, ADAS East, which is the bottom end of the country to you, not quite Kent, and the Northeast, and we do quite a bit with partners in care and health as well. Similar approaches, for opening up conversations around different things to do with information advice, direct payments, housing, and that was one of the examples that we share today. Jack, do you just want to say a quick hello?
Hello, there will be a lot of people on this call that already know me, because I'm from the northeast and I love it here, and particularly South Tyneside. I've worked with you quite a lot, and from adult social care. I've been working as a social care consultant now for many years, and I've been co-producing for 10 years as well. And I've been working with Curators of Change with Over a Brew Northeast very proudly. And I've been a huge supporter of the work they do for the last many years too. So we're hoping we're going to bring something very valuable to the session. We will use some slides and we can make some of those available as well at the end. We can pass those through to Kerry.
Yeah, brilliant. I'm going to share my screen. I should also say, actually, the Northeast is where my heart is. So when we talk about home, I was born and bred in Saltburn by the sea, and spent the first 18 years of my life in the Northeast. So yeah, it's a very, very, it's very close to me, that part of the world. So it's nice to be here with people. I know not everybody will be from the Northeast, as such, but original. But yeah, it feels a bit like coming home. Right, I shall just share my screen. We wanted to start just by asking people a question. And just go to, oh, sorry, in true Overbrew style. I am not quite in the place I thought I was. Oh no, something's gone wrong.
Well, I'll pop that wrong right, and I will say, Kat and I had a sneaky kind of thing if we'd all get you to participate in a little wee icebreaker in Overbrew style. And the question is, what comes to mind when we mention the word home? So if you could put your answers in the chat, that'll be fantastic. If you can't put them in chat, please unmic and say yours out loud.
Okay. Right, I should just work out what I've done here. I think I've got multiple versions of things open.
So we've got feeling safe and family, security, feeling safe and protected, and feeling loved, family, somewhere to feel comfortable, happy and safe. I really like that, Sharon, because it does sum up quite a lot and a basic need we should all have. Family, love, safety and warmth, feeling safe, happy and content, belonging, safe, relaxed, happy again. Oh, I love that, Sean. As a relatively recent cat parent, it's where my cat is.
Oh.
And I align with that so much as a fellow cat owner as well. Somewhere where you can be yourself. Brilliant, Rebecca. Sharon, I really like yours. In somewhere we have connections and an environment we enjoy being in. And Leslie, how fortunate you are to be beside the sea.
Oh, yeah.
Thank you for everybody for indulging us with that first question.
No, that's brilliant. And thank you, Jack, because I realised when I share the screen, I can't see the chat. So that was seamless. Like we planned all of that. Thank you. No, really great to hear some of those things, and just keep that in mind as we go through the session. There will be a little bit of a point I really invite people to interact in the chat actually, and we really value that in these sessions in the Overbrews. But we'd really love a bit later in the session to actually hear from people as well. So I know this is a bit of a webinar setup, but if people are feeling like they want to kind of speak out some of their thoughts in response to some of this, then that would be brilliant as well. So here to just share a little bit about our journey with Overbrew, but in particular for today's session, how that influenced some of the work that happened in ADAS East when we spent some time co-producing the place we call home, a guide. So that's the guide is putting people at the heart of new housing development, and the guide itself was done through the format that we use in the Overbrew sessions, through working with people's stories and experiences, and through coming together just to talk about what that means and what are the things that are really important to people. So we can share a link to that. It is available online, but it came directly out of the conversations that we've been having regionally with people in this very kind of informal and agendaed way. So I'll do a very quick introduction to that and an overview of how we use stories in that. So we use a methodology from an organisation called People's Voice Media, which is community reporting, and it's helpful for you to have that context as well as we go to listen to a couple of the stories that we captured as part of that work. To hear, obviously that I just said, how we applied these principles and this way of working to developing that guide. And then between us, Jack and I have got some different stories and examples that we want to invite you to reflect on And then if you've got time for any questions or reflections from you at the end. One of the things that I like to refer back to, because a lot of the inspiration for us and the Over a Brews and the way that we run them was drawn from Camarades, and some people might be familiar with Camarades as a movement. Again, the connection there from Matt Potts, who was the founder, is that Matt worked in homelessness for many years, and I know the focus today isn't specifically around homelessness, but his background and interest was understanding why people struggle to find and get settled in the housing, what it is about the system that he'd become so frustrated with as a practitioner in this space. It is that stops that. And his recent book actually is entitled Friends and Purpose. But the thing that he just kept coming back to was, and I think it came up in the chat in the response to when we hear the word home, is that what people need most in life is that sense of friends and purpose. But along that journey, he realised there are certain principles that need to be in place to support that process. So these principles that are on the screen, things like mixing with people who are not like you, is fundamental not only to that in terms of what Camarados was trying to achieve, but we've learnt that in relation to co-production. And co-production is about, and having those conversations with people and being in these spaces is about deliberately mixing with the people and having the conversations on a human level that we wouldn't normally do in maybe our professional working life or in other areas of life. And so that mixing it up is a really fundamental part of what we do. And again, talking about co-production, a lot of the stories that we hear are the healing impact of the way that we work with people, is that by mixing it up and having those conversations, not fixing and just being alongside one another, and having that space where it's okay to be a bit rubbish with each other and not always get it right, and not always to disagree actually, but how we do that in a respectful way within that is actually, rather than being in that space of you're wrong, I need to fix, you've got it, made a mistake, is you're struggling with this, actually I'm struggling with it too, so why don't you come and help me? And flipping it a little bit. And really for us, that's the essence of what co-production is about, how we flip it into a space of saying, this is difficult, it's really challenging to get services and support right for people, so will you please come and help us with this? Will you come and help me? And that can be on a very individual micro level, as well as at that bigger, more global level. And I would say actually at the smaller individual level, it's where it becomes more powerful and impactful and has the potential to ripple out, if you like, and bring bigger changes. And to be silly is to be human. Actually, we don't always want to be serious in the spaces. And sometimes we'll ask questions like, what's your favourite biscuit? In fact, if you want to tell us what your favourite biscuit is in the chat, please tell us in the chat what your favourite biscuit is, because we're always curious to know things like that about each other. And in those really human conversations at that level is when we start to really learn more about each other. I'm not going to go into the detail of Over a Brew, and there's plenty of stuff up on the ADAS East website about it. Sorry, I'm really not controlling my screen well here. Oh wow. It's okay to be rubbish sometimes. But this quote from Tash in the East region really does sum up what it's about. And it came from an initial piece of work we did around the market development priorities in the region. And when we got to the end of that piece of work, to think about where next, people really said the priorities, the practical things that happen are not really an issue. They need to happen. We can't change that. What needs to change is our experience of being on the receiving end of those priorities as people with lived experience. And the way to get to that place is not through boards and rigid agendas. It is being able to hand over the power and create a space and room where we decide together how we want to shape things. So the space, the Over a Brew space, any of the workshops that we do, we try and make them a space for all that are open to anybody. So there's no strict governance around it. You can be anybody who touches on social care, health, or anything related. You could be a member of the public, to be honest, to join in with those spaces. And it's about bringing all those people together in an equal space to have the conversation. So the big emphasis on the time we spend in breakout rooms, small breakout rooms with each other, listening and then reflecting to each other's perspectives. But we are 4 years, maybe 5 years into that journey now in the Eastern region, and we're beginning to see some of the impacts regionally. And we're now kind of pushing to go into that much more on a local level as well. And it hasn't been easy. It isn't easy. It doesn't happen overnight. But seeing the difference in relationships between directors in care and those people with a lived experience, and the healing that goes on between them, has been quite a powerful, if not magical, experience at times. But we're not taking our eye off the ball, as it were. There's still a long way to go with it. I'm sharing this because I think it just gives a little bit of context. We use a method, we use other facilitation methods in the sessions, but we use a method called community reporting, because actually putting the voices of people with lived experience at the heart of any conversations about what we want to develop, whether it's a guide around co-producing housing, whatever it is really, really important. But this process allows us to work with the stories in a little bit of a more structured way. So we capture the stories in a very open-ended way. We then take extracts from those stories, we listen to them in workshops, and we talk together about the impact, what we're learning, how they make us feel. And then we think about how then we apply that to the change or the work or whatever it is we're trying to bring about. So in the Over a Brew sessions, they're often set up with a couple of people's stories digitally. And again, digital, people respond differently to that. Having it presented as a video or audio really changes the way that we engage with stuff sometimes, but it gives us the flexibility to work with those stories in lots of different ways. And it matters because that experiential knowledge, that lived experience knowledge, helps us to understand the different perspectives. It helps us to understand the feelings and the emotions that sit behind people's experiences, and that's something that we often forget about. And it helps us to understand more what's really, really important to each other. It helps us to be able to see what's going on in terms of some of the other forms of data that we might have. It brings it to life. Stories are data, and sometimes they forget that. And I will often say, you know, give me people's stories, the narrative, qualitative, I have to think about that very hard, qualitative information from people. And I can quantify that back to you in terms of numbers and data, but in a way that's more meaningful. If you just give me data as numbers, I can't qualify that in any way whatsoever, because I don't know why people feel that things are good or bad or indifferent. So I don't know how to respond to that. I don't know what to do more of or less of, or keep doing the same, as it were. And it really does change the hearts and minds, because it brings stuff to life to people, and it holds up a mirror in some ways in terms of the experiences that people have. So how did we apply that to this piece of work? We went through that process of capturing people's stories and experiences. We created space for conversations about what good housing means to people, that question that we asked at the start. You know, what comes to mind when you hear the word home? What does home mean to you? Those kinds of questions. And we also then worked with people to think about, okay, well, how should the guide look and feel? And the people who were involved in the co-production of that process went through a process actually of rating the case studies and rejecting some of them, saying that's just not good enough. And other ones saying this is good, but it's not co-production, but it's a good example, to this is a good example. So there's little stars and balloons in the key in there that was something that came from that direct lived experience. So I just wanted to, before I hand over to Jack, just checking the time, is just play this short audio extract. And as you are listening to this, I was going to create a clipboard, but I haven't done that. So just pop any thoughts in the chat, or note them down. What are you feeling or experiencing as you listen? That should be the first question there. What feelings and experiences come to mind? What do you notice in your body as you're listening to this? And what are the key messages? How does this relate to your experiences? And is there any learning that kind of emerges out of this? Just let me go. Click the share sound button. So I'm going to hit play. And Jack, you're going to give me a thumbs up because I can see you to let me know that you can hear this. All right.
I'm a person with lived experience of homelessness, also a person that's very passionate about co-production, and a person that's been there and got the t-shirt with regards to housing.
Why is it important to involve people in housing?
In any type of housing, because I think that the people that normally make the decisions, the people that normally do the decisions about housing and people's needs normally live very far away from the particular places that they're actually talking about. So you need to have people that are going to be living there and being part of that. And it's not only about the housing as well, it's about the community, it's about where it's situated, it's about what community facilities you've got around by the houses. Is the doctor's surgery local? Is there shops local? Is there a green space even local? All these little factors need to be factored in, because a lot of people forget all about this. People just think that a house or a place that you live in is a roof over your head, but there's so much more. It's so much more than just a box that you stay in and you sleep in. The main top tip is get people similar to me, not only me, but other people in the room around the table, and also listen to us as well. I know that fear factor comes into play immediately whenever there is any sort of co-production, co-design, co-delivery, whatever. There's always that fear that, oh my god, we've got people around the table that are not professionals. Actually, we are professionals in our own field because we're professionals in our experience. So get rid of that fear, speak with us, try and also speak with us without that sort of prejudging or that prejudgment, because sometimes you sit around a table and you are prejudged before you even open your mouth, you know. So I think that's one of the top tips there. Also, just listen to us. Just, yeah, we might get a little bit irate or we might get a little bit rowdy in the sense, in a good sense. I would always say that. But listen to us. The reason why we're doing that is because we're passionate. It's a complete passion of people. If you're given the voice, finally, of either co-designing something or being part of something at the very beginning, there is such a lot of passion about. And also, you can then have, I would hope, a project that is fit for purpose, because it's not all about stats and looking at what we should be doing or what we've been told to do. It's actually, we're getting people involved and we're doing what we need to do for those people.
I'm a mother to a young lady of 30 now and with special needs, etc. And she's living with me, and we're living in a housing setting that actually I'm now very passionate about being involved in this project because of the opportunity that it gives me to be able to add a little bit of our story and our people that we're meeting in our lives who have the same difficulties we're experiencing. And I think the co-designing is very important from the onset. I think if people that actually need the houses were involved at the beginning, half of the battles that we're fighting now wouldn't be as huge as they are. I think to be part of the community that you want to live in and choose to live in is key, because people around you get to know you, know your needs, know what it is they can support you with. And that if, like, for instance, I'm living in a block and across our block is another neighbor, maybe they've also got their needs, but at least they know my needs because mine have been there from the beginning and they know about them. So if they don't see me for a few days or my daughter for a few days, it makes alarm bells go. Oh, let's just go and see if there's anything going on. I could be lying behind the door and she doesn't know then what's the next thing to do except for 999. What I'm trying to say is the people you live with are people that become family if you're known to have all of these other issues in your life. It's not as if you're a stranger in the street and people are going to pick you up and think, oh, I'm helping you, go to, AA. The home environment is crucial because you have to make those links. I just wish that there is some nugget from this project that will come, not only because it's on paper and it's legislated, but that people will embrace, because we all are in some way or another challenged in this life. We're not unique, but it would be nice to consider, put yourself in our shoes for a second. It just makes that much of a difference. Because it's not as if we want everything being spoon-fed. We want to be part of the change. We want to make a difference in our own lives and those that come beyond and be, in front of us.
Just a moment for people to reflect on that and pop any thoughts in the chat, and then I'm going to hand over to Jack, because I want Jack to have the space as well. We've only got a little bit of time left.
I think Kerry and I have put a good reflection in the chat that we've thought about whilst we were listening to those. I'm going to share my screen now, if that's all right with you, Kat.
Yes, go for it.
I'll just shut one down. There we go. Okay, so that segues me nicely into just doing a little plug for Over a Brew for North East and North Cumbria whilst I have you all here, because if you all on this call brought one person with lived experience of health and social care, and in particular anybody at all that you're working with or any colleagues, to come along to the Over a Brew session that we have monthly. I have already put the link in the chat for people to access tickets from Ticket Source. It's a free event happening on the last Friday of every month. I won't be there this week because I'm having a little holiday, but hopefully I'll see you in this space very soon. But you'll get to meet all of the team that have been working with Kerry to build this. And it also brings me quite nicely to my next slide, which would be just a reminder of the social care future messaging that we have about people being within their own communities and their own homes.
We all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. But for many, this is not the reality today. And without big changes to the way we think about social care, many more of us will face losing control over our lives and contact with the people and things that make our lives worthwhile. It doesn't have to be this way. At its best, social care helps us to find, grow, and weave together the people, places, and resources that we can draw upon to live where we choose, in the way that we want, with meaning, purpose, and a sense of belonging at every age and stage of life. Realised through innovative approaches like circles of support, shared lives, and gig and sports buddies. We need this to be the reality everywhere and for everyone. To do this, our government needs to invest in social care, and our local councils must work with the people they serve, so creative approaches can take root and begin to thrive. Let's start growing this social care future together. For all our futures, share this video and join our movement for change.
I wanted to do a little bit of co-production in the style of the work that we've been doing in Over a Brew and bring people's stories to life. And I have a PA called Shannon, and we've co-produced this as a piece of work because Shannon has, she was at the end of a tether in a privately rented rundown home, and her worry was about the walls at first with creeping black mould, and soon it was about her child playing in a home that was making them all ill. First it was his asthma, then her own depressed feelings about cracks she could not fill. The landlords were non-responsive and avoided all of her calls, so off she went to the council expecting them to respond with the help she needed. Now, in an ideal world, if they used a co-produced action plan approach when she got there, she would feel help straight away. She had identified her end goal and wanted to be engaged in a compassionate and supportive way. So I asked Shannon about how could she be helped in an ideal world. And I merged my skills with Shannon's and identified communicate, resources, support, action, and help. And what would Shannon feel would be the best thing that suited her needs in those areas? So for communicate, it was time to talk the problem through and feel genuinely heard in a compassionate and understanding way. And time to express the impact of what she had experienced at home and share their story in a different facilitated way. And that Shannon said, I've been attending the Over a Bruise, and I think that's a really good way to share experiences and learn from one another. So it's not just about that communicate that we do directly face to face every day within a local authority, but it is about those resources that we can bring in to facilitate those additional conversations as well. And you know, I must say that gives people resolve to be heard. Practical resources like a dehumidifier on loan for a month, and a £10 electricity top-up card because she wouldn't be able to manage the living costs and the running costs herself. But that was what she felt would be most helpful from a practical perspective. A basic £30 mould cleaning kit meant she could have access to immediate things she couldn't afford. And I give Shannon education about not using bleach, because I've spoke to other people with lived experience who've gone directly to deal with their mould by using a bleach spray. And bleach reacts with mould. It offers it an opportunity to grow, to develop, and it comes back twice as fast, twice as readily if the walls are not washed down properly afterwards and the bleach is diluted. So Shannon learned a lot from that imparting of things about how to use resources, and that's perhaps somewhere where councils could look at as well about education. The local authority acted by contacting the landlords, and they were given notice to improve the house. And we have a scheme here in Stockton-on-Tees where certain areas landlords have to apply for permits, and with these permits come about with regular inspections. And the house where Shannon lives is not in one of these areas. So the expansion of that scheme would really, really help Shannon. Help with letter templates as well to send to a landlord and have these downloadable in a format that Shannon can use. And education around her rights to a warm, dry home, given to her as well. And I think we don't do enough of that to say, this is what your entitlement is. This is what your human rights cover. This is what the Care Act covers. This is what we should be providing for you for housing. And on the opposite side of that, people need to know the constraints that you have within local authorities, and that you cannot be a Mary Poppins to all, that you cannot provide everything. But if you can keep people's expectations real by saying this is what we cannot do for you, I think that's kind of a really, really good place to start with people, and it's that honesty. Times and venues of community warm spaces to visit during the day. This is a great idea from Shannon, and she's aware of some of these that she's used through the cost of living crisis. Places where a child could go to mix with others and safely play within the community. Places where a child could go and mix as well. We mustn't forget within social work practice and social care that we still, as we focus on the strengths-based approach, the strangest thing somebody ever said to me from a council this year is, Oh, well, we used to use a community assets approach, but we don't now. We're just trying to just do strengths-based approach, and we should actually be using both alongside one another because each have their own merits to help people live a more fulfilled life. So it's what can we learn from the practice that we've already got in place, and what we used to do is actually still has some relevance. We just need to use it in new ways. And the detail of a warm home scheme as well, we taught Shannon that in terms of getting information on insulation and funding a new boiler as well. And whilst I talk about education, it's kind of sharing with Shannon about the purpose of ventilation and how that could be helped within that living space as well. On the support side of things, because we're all about human here with the work with curators of change. So somebody not treated as a complainant, but as a human in need of a safe and comfortable home. And it's how we can look at transforming our approaches within local authorities to remove the fact that people need to complain first before something is heard and dealt with. And also removing that barrier that people have a perception that that's what they need to bounce to first is, I need to complain, I need to get this sorted, and I've got no other way than really showing people how angry and upset and frustrated and that negative emotion trail first. Active listening, empathy, and genuine desire to find short and long-term solutions would really, really help Shannon have the right approach. And having lived experience valued and a solutions-focused fix that is personal to Shannon and Shannon's home. And no blanket responses of this is what we do for everybody. Let's try something individualised for Shannon. And around that is compassion and a welcoming, no appointment needed approach. Appointments at citizens advice bureaus are through the roof now, and there is weeks and weeks of wait for people, and this does exacerbate stress. So how could we open that up in our contact centres? And the things are within a preferred communication needs, and if we have somebody who just does email, they probably do that for a reason. I like to write everything out that I'm going to talk about on the slide because it helps me with my deficit with my short-term memory loss. And I love emails as well. They work much better. I know they don't always read better for people, but they work better as a mode of being able to think about what I would like to express. Co-producing a response would really, really help Shannon. An agreed plan of action where Shannon had a lot of feed-in of let's find a solution for Shannon, and Shannon has constructed part of that solution as well. And that things are regularly and reviewed and reported on. And while I look at housing and the work that we do within Curators of Change, it is very much centred in looking after people in the process. So I thought top tips, and I asked Kerry about this, so thank you so much, Kerry. I asked you for your 6 key areas of priority, and I really built this into what I would like to say this morning, that we should treat people and prioritise and promote empathy by understanding lived experience, and it fosters meaningful support as well, and ensuring culture of the organisation reflects this holistically across the board. And compassion becomes a driver, an adopted practice for helping people have healthier homes. That we promote dignity and that everyone deserves to live in a safe, healthy housing that's warm and dry, with a roof over every person's head. And that we promote respect, and that everyone deserves to live in a way that they recognise as their own culture and choice, respecting the right to ask for our help and support when housing is not right. And that we deal with those channels in so people can feed that in much more diverse ways. Equity and addressing housing disparities improves health outcomes and promotes the thriving of a family unit. To access accessible housing that meets the needs of people with additional needs, disabilities, and larger homes for growing families as well. And action is something that we need to obviously promote. And you'll all be obviously great at that now, but it's listening should lead to real change and policy shifts, that we don't take ideas, responses and feedback and co-production and we do nothing with it. It stands on a shelf. Some of the smallest measures produce the largest outcomes, and doing something different to suit the needs of an individual brings about a person-centered approach. And co-production as well. It's at the heart of everything I love to do and at the heart of everything Kat loves to do over at Curators for Change. But co-producing housing design and embedding regular co-production to facilitate and measure the impact of housing issues really needs to happen. And what's really, really good to focus on as well is we're not selling our good news stories enough. We're hearing what is wrong more than we're hearing what is right. So having a platform on the website to look at people's individual stories and do that story collecting in a meaningful way as well will enable other people to have trust and inspiration and believe that all of you on here can do their very best for a person. We all like to know a story turns out well. And well-being, that we must prioritise and promote that above anything on this page, because poor housing affects physical and mental health and the lives of those living with long-term health conditions. Working towards better outcomes that can reduce stress, emotional burden and dismay encountered along the way. And that advocacy as well isn't just simply the Citizens Advice Bureau is there. Please go and speak to them about your rights. Please go and speak to this group. It's boiling back to those community assets again. And professionals must amplify voices we do not regularly hear from, and recognising the duty to provide information and advocacy around housing themselves. That assets-based approaches should not be reduced, but used alongside strengths-based approach, particularly in social work. And that we seek opportunity and that we increase opportunities for co-production, which brings people together to share their experiences. Providing policy framing, sharing lived experience to shape practice through storytelling. And I love this, innovation and adapted thinking, that we feed into that social care future vision that we looked at in the video beginning, and that we improve our approach towards building communities where people can live in their own homes for longer and be equipped safely to do so, and that we innovate our thinking beyond what we do now and cater for the ageing population in different ways to what we do now.
Thank you, Jack. That was really lovely. I think we've had lose a couple of people because unfortunately we've run over, but I think it's really powerful and there's some really positive comments in the chat. Some people are connecting, and I think that those connections and the way that we work together is exactly how we overcome some of those challenges that we're all facing in systems that don't quite work. And just taking the time out to share the stories and the work that you're doing and the overbrews, I think is really powerful. And just make sure you thank Shannon again for agreeing to share her story with us all. That's really brilliant and really, really, really powerful. I don't know, I know we're overrunning a little bit. I wonder if anyone has any questions before we draw the session to a close. It's just to remind you, we will send the slides out. This has been recorded. It will be on the Boost platform next week. And there will be a link, I believe, going out about feedback, and it will be really great to hear people's comments. It's in the chat there. Thanks, Suzanne. If you can take a couple of minutes just to fill that in. I know everyone's really busy, but it does help us shape the webinar program and our wider work. And yeah, I think that's it. And just Sean's still on the call, so they'll take any emails if anyone wants to join the community of practice. So there's lots of ways you can get involved. But thank you very much, everyone, for joining us this morning, and I hope you all have a lovely sunny afternoon.